Dr. Greenberg began his medical career in internal medicine at Georgetown University Hospital and later pursued his interest in dermatology with a dermatology research fellowship at the University of Wisconsin and dermatology training at Scott and White of the Texas A&M University Health System. Dr. Greenberg is board certified in both dermatology and internal medicine. He serves as clinical assistant professor in the Department of Internal Medicine at the University of Nevada School of Medicine, where he enjoys teaching medical residents. Additionally, he has written multiple articles and book chapters on different aspects of dermatology, including laser treatment of scars and striae. Dr. Greenberg has held multiple cosmetic events around Las Vegas, including an event with the American's Next Top Model and a fuller lips for bigger tips promotion. Love it. Please welcome Dr. Greenberg.
I'd like to thank you all for having me here. I plan on giving a talk just about the basics of fillers, what they are and how they work, as well as some practical tips that will make it useful for you when you're thinking about, is this the appropriate person to have filler? Anybody can inject. The key is knowing when not to inject. So it's easy for somebody to talk you into something, but you have to have some reservations when you go into these things if their motivation is not the proper motivation and if their expectations are not appropriate. So I do have multiple disclosures. I speak for a number of different companies. I do speak on the medical side for Medisys, but I do not speak on their cosmetic side. And I speak for a laser company, but none of these companies that I speak for should have any bearing on this talk today. So to begin with, fillers in general are used to contour and volumize different areas. People ask all the time, well, you know, is this going to be paralyzing the muscles? No, this is just purely for areas where there's volume loss. And over time, when we have young skin, it's smooth, it's elastic. As we age, we lose volume and we start to wrinkle. Hyaluronic acid is really the major component of fillers in our body, and we start to lose that over time. And the most popular injectables at this point are hyaluronic acids, and I'm going to be spending the majority of my time during this lecture talking about hyaluronic acids for multiple reasons, not the least of which is if you get into trouble with a hyaluronic acid, you can get rid of it. Whereas with all of the other products, whether it's calcium hydroxyapatite or Sculptura, when you get into trouble, you're done. And there's nothing that you can do to get rid of the product except for possibly cutting that product out of the body. Just some basics. When you see a child, they have very full faces. There's a lot of fat, and everything is symmetric and rounded. As we age, everything becomes deflated and flabby. It's like you have a beach ball that has shrunken in. And I like to equate it sometimes to people when they ask, it's like when you have a banana also, and it's yellow and it looks really nice. As the banana gets older, it shrinks down and gets spotted. In this case, we're going to be talking about the shrinkage. I always tell my patients the best thing they can do to protect themselves is to wear sunscreen. A number of different things come into effect when we're talking about which products to use and which areas to use and what things are we thinking about. Not the least of which is this financial component. So people need to be aware that when you tell them, I think you're going to need 2 or 3 syringes of filler, that you think they need 2 or 3 syringes of filler. And if you give them 1 syringe of filler because that's all they can afford, they may be upset with you. So in order to maximize your expectations, it may be, in that case, worth not doing the procedure. Instead of putting in 1 syringe of filler, they said, I only had $600, and now I'm upset because it really didn't do anything. When you know that it's not really going to do anything, just don't even do the procedure. Manage their expectations. Other things that may make it so that you don't want to do the procedure on them, somebody's pregnant, somebody has a history of hypersensitivity reaction, that is an absolute contraindication. And then if somebody, and I always ask, has a history of cold sores, you can still treat them if you're doing lips or perioral treatments, but make sure that you pre-treat them with Valtrex or acyclovir. So hyaluronic acids, they're natural polysaccharides. They're ubiquitous in mammals. They fill, they bind water. The ones that we're using for injectable purposes will last 6 to 9 months, and that's because of the way that they're cross-linked. Our own natural hyaluronic acids in our body may not last as long as these ones that are synthetic hyaluronic acids, but this is the indication, 6 to 9 months. You can tell people that it will last up to 1 year in time. Contraindications, pregnancy, history of anaphylaxis. If they have an active infection, there's absolutely no reason to be injecting them. The newer hyaluronic acid injectables all have lidocaine in them. So getting a history of allergy from a patient and knowing whether they're lidocaine allergic or not would be important. In certain cases, you may not want to inject the lidocaine if people tell you they get jittery, so you have to elicit that history from them. People who are on blood thinners may bruise more easily, and you may have more problems with those people. That doesn't mean that you can't inject somebody who's on warfarin, but if they are on that, make sure you warn them about their bruising history, and if you're really concerned, perhaps get an INR beforehand so you don't inject them when their level is above the 2 to 3 range for normal. This will be the one slide I have on Radiesse. It's calcium hydroxyapatite. It is a great drug for injection, and it does last up to 2 years. It is bone cement, and it is used in different aspects of medicine. And in dermatology, we use it basically for the nasolabial folds. It was tested in lips and tear trough. Granulomas were discovered when that happened, and granulomas are a possibility with this injectable. The other thing is, like I said, if you get into trouble with this injection, you can't dissolve the product like you can hyaluronic acids. So because hyaluronic acids can be dissolved with hyaluronidase, that's a benefit. Not being able to dissolve a product is an issue. So it's just something to be aware of. There are people who say, I would like to have a longer lasting product, and I realize the risks. And for those people, fine, go ahead and do it. Sculptura, polylactic acid, is actually vicryl suture that's been cut up and put into a powder that is then put into solution. It's mixed overnight. Between 5 to 6 cc's of bacteriostatic saline are used to mix up the product. The patient will come in the next day for injection. The problem I have in my clinic is I live in Las Vegas, and it's kind of a flaky town in some regards. So unless you get those dollars up front, you may end up having a patient who no-shows. You've mixed the product is skunked, and you have nothing to show for it. So if you are going to inject this product, it's treated with a series of treatments spaced 4 weeks apart, and it volumizes in the areas of the face where it's injected. Granulomas are also a possibility with this injectable, so it's something to be wary of. Sometimes it looks phenomenal, and there's a nice fullness to the face with it, and sometimes people can look freakish with it. So I would say if this is your injectable of choice, and it is FDA approved for HIV lipoatrophy, it lasts a long time, and it can show dramatic improvement. I don't personally use it. I've never injected it, but that's not to say that it's not a great product. If this is your product of choice, make sure that you get comfortable with it and get well trained before you start doing it. Different areas to inject. You do not want to inject hyaluronic acids in the epidermis. It's not going to do you any good. It will show what's called the Tyndall effect. And the Tyndall effect is where, because of the way that light reflects off the skin, and because of the color of the product itself, you can see a bluish dyspigmentation with having these products up too high in the skin. Inject them too low, and you can run into problems as well. There's a sweet spot in the mid-dermis that you would like to put the products, and it does also depend on the area that you're injecting. So, nasolabial folds, mid-dermis, maybe slightly higher up in the tear troughs, but you're going to want to be a little bit wary so that you don't go too high and then show the blue discoloration. It's a very unforgiving area when you inject up there. There are different ways to inject. Everybody develops their own style. There's Serial puncture, where there are multiple injection sites. There's linear threading, where it's one injection, lay down product as you're pulling back. One injection, lay down product as you're pulling back. That's how I do it. There is cross-hatching, where you lay down the product in one direction, and then you go in the opposite direction to sort of build a lattice work of hyaluronic acid. And then there are trocar injections. I don't personally use a trocar to inject. There are a lot of injectors who do. And for those folks, they pierce the skin. Then they use a larger trocar that they put through the piercing, and they fan out in just one area all of the product. It does look great, and you can get a deeper injection that way. It's just not something that I do in my practice. Again, this is the type of thing that you personally are going to have to be comfortable with whatever choice you make in terms of treating people. And if what you're doing works, I don't see a reason to change it, and especially if you're getting good results. Pre-injection techniques. Before you do anything, always get a history and make sure that you're asking the important questions. Are you pregnant? And do you have a hypersensitivity, allergy to, or have you ever had a hypersensitivity reaction? That would be important to know. And then do you have a history of cold sores if you're going to be injecting the lips? A lot of people don't remember. I have seen complications from other practitioners who've injected lips and have had just an entire flare of half the face with a cold sore. So that's another problem. Some people like pre-chilling with ice. Some people like to use ice while they're injecting. I don't. Topical anesthetics, we typically use LMX in my clinic. With the newer injectable fillers, they have lidocaine in them. So as you're injecting, it's numbing. For most areas, that's adequate. Nerve blocks can be done in order to treat super sensitive people. I've never had to do a nerve block for filler. I do a lot of perioral ring blocks, and that would be for somebody who's getting injections on their lips. What I do is, and you'll see it today because we have a couple lip patients that I'll be injecting. We take Hurricane, which is a topical painkiller, and we put cotton tips in there, put 4 areas in the mouth, and then just inject in a circle around the mouth. And the benefit to doing that is twofold. One, it provides anesthesia, perioral anesthesia, and 2, we use epinephrine. And what that does is it constricts blood flow, and it will make it so that there's less bruising. So the lip injections can be done in that way with less bruising, and you can get an improved result and a happier patient. Landmarks are really important. Everything that's important on the face is 2.5 centimeters from the midline. That would be this supraorbital foramen, infraorbital foramen, and the mental foramen. That's where you would go for your nerve blocks if you were blocking. Again, you don't really have to for what we'll be doing. But just mid-pupillary line. And these are some stock photos that I took from a Medicis presentation. Typical areas: nasolabial folds, marionette lines, 1 ml of filler, 1 ml, 2 1 ml syringes. And these would be pretty typical results. And these are easy. I mean, this is a standard type of injection. A lot of people are used to this. There's nothing out of the box with this type of injection. When I inject in this area, typically I'll start right at that point and go up, go there, go across, come down, and do the same. You want to make sure you go high enough up here that you get rid of this little fold, but you don't want to go so high that you make them look like a chimpanzee. So it can be tricky, and you don't want to overfill. If you underfill, you can always correct. If you overfill, you can correct that as well, but then you're going to be dissolving product, and you'll have an upset patient. Important to get good photos. So people look different with and without makeup, and it's just, I can't overemphasize how important it is to get good before pictures of every single person that you do a procedure on, because inevitably they're going to be upset with something and they're not going to remember that they were asymmetric. Everyone is asymmetric. We are not equal on both sides of the face. And so this woman here without makeup looks like everyone else, but with makeup, this is Pam Anderson. So it's just important to make sure you get them, if you can, without makeup when you do your photos. These are some of my patients that I've done in private practice. This patient had Juvederm. She had 2 syringes done, nasolabial folds. There's a nice improvement here, and she was very happy with that result. Again, this is easy. She has nice high cheekbones, and the only area of volume loss here is the nasolabial fold. This woman I didn't think needed anything, but she didn't like her lips. So it's important to elicit from somebody, what about your lips don't you like? For her, she wanted a better lining to her lip. She didn't like that it wasn't sharp. I thought it looked fine. But what I did was I lined her lips, in this case with Restylane, and then just bulked a little bit. There's a standard ratio for lips, and that is a ratio of 1 to 1.3. The bottom lip is always larger than the top lip. There are people, and especially in Las Vegas, who want both of them to be super large. And just so long as you document that that's what they want, and that's what you can do. This woman had a very attractive lady, but has a large lower lip, and her upper lip was small. And she didn't like that. So I filled mostly in the upper lip, in this case. For most people that I fill, I like to leave this outer area, this outer 1/3 of the lip untouched, and just stay the medial 2/3 of the lip. And that's sort of what they call the Parisian pout, keeping it right in the middle. Everybody's different with how they do it. If you extend those lips out, you can end up making somebody look like a duck. So that may not be what you're looking for. They may tell you, I want, and I see it in my clinic, I want freakishly abnormal lips. I don't want anybody to think that mine are normal. And it happens, and you just document that that's what they wanted, and buyer beware. Great for scars. There are very few products that can affect a scar like this. You notice that it's a little bit whiter here, and that's because this is a chickenpox scar and had been present for 15 to 20 years. You can notice that it's white, and that's because it just hasn't had any sun exposure because of where it was located. Let somebody know that if you do inject their scar, there will be improvement. The contours will be smoother, but it may not affect the color. So again, managing the expectations is just so important. Another patient here, I can't remember if this was a dog bite or a piece of glass that was cut, but you can see the improvement just by injecting Restylane along the line. And you could inject Juvederm just as easily. You could inject Radiesse in this area. I would feel totally comfortable injecting any of those products in this particular scar. Other options would be a resurfacing laser or excision, but fillers are just so nice in this area, and it may be your cheapest way to go. There are 0.4 ml syringes that you can use in these areas. A neat little trick for somebody who's on the fence and doesn't know, do I want a filler, do I not want a filler, how's it going to look? You can always just inject saline and show them this is what it would look like. And then you can have an idea of what that result would be. And you could do that for your consultation. Just a dramatic result here of this woman had no lips, lined the lips, filled the lips, and just a little bit in the nasolabial folds. You're not always going to be able to give somebody lips, no matter what you do. And it's important, again, to manage the expectations and let them know, yes, you want to look like Angelina Jolie, but you don't have her parents. And it's not going to look like that. It's going to look like you with bigger lips. And that was here. It's good for people who complain that they have lipstick that runs, because a lot of times giving them a nice molding to the lip will make it so the lipstick is less likely to run, and you can use that as a selling point when you do when you do inject someone's lips. And for orbital hollows, I don't know if you can see in this, her eyes were a little bit sunken in. It's probably one of my least favorite areas to inject just because it's so unforgiving. It can be rubbed once you've laid the product down. And a lot of times I will tell people, rub the product in to where you want it to be. But that's another option. I'm using a lot of combination with injection, CO2 resurfacing laser in this area, and botulinum toxins to help. There's also a new device out called the Opal, which is by the Clarisonic people, and it's a topical that can be used for crow's feet to improve the cosmetic appearance. So it's not going to long-term affect anything like a filler, which would volumize the area, but it will give the appearance of more fullness. This patient I just did on October 18th, and I injected the dorsal hands with Restylane. What I did was she didn't like the veins that were here on the backs of her hands, and I injected by pinching the skin and going right underneath into the dermis, just right under that epidermis, right in the dermis, and going along where the veins were. Now, I didn't inject into the veins. You don't want to do that, but making sure that you're just to the sides of them. Ended up bulking out real nice here to the point that she was happy with this. I told her she needed 4 syringes. We did 3, and because of the economics of the situation, we charged right around $600 a syringe, $1,800 for this area. That's what she could afford. She knew that she may need another and was okay with that. This is from Vail, Colorado, and it's one of my favorite slides in that sometimes there are no good decisions. Whichever way you go, you're kind of screwed. So when you come into a complication, and it's going to happen, you treat enough people, you will have a complication, and you're going to have upset patients. It's a matter of experience dealing with people who are upset because there are complications and there are real complications. So if you warn somebody beforehand that something could happen, that's informed consent. If you tell them after you've done it, then that makes you look bad. So always warn people that you could be bruised, you could be red, you're going to have some swelling before you do it. You can always dissolve these products with hyaluronidase, the hyaluronic acids. And the way we even have some here today for our injection on hand in case we get into immediate trouble. But you mix the hyaluronidase with lidocaine. It's funny, and I've heard so many lectures now where the speaker has said, well, you're going to want to test to see, because it's an animal protein, if they are allergic to the hyaluronidase. The fact is, you're not ever going to test them to see if they're allergic to it. Hopefully and ideally, you never use the product because it's going to be gone in 6 to 9 months anyway. But if you have to, you have to, and you can use it and you can inject people with that product. I've never used it, but I have it available to me. Nitro paste is always good to have in case you inject someone and they immediately blanch, meaning that you've just hit an artery. What you're going to want to do then is put the nitro paste on, and you may want to inject hyaluronidase right away, but that will increase the blood flow to the area. You don't want to get skin necrosis by injecting into an artery. The likelihood of you doing this is super low because you shouldn't be going that deep when you're injecting. Areas of high risk would be the glabella, and I don't inject the glabella with these products unless I have already told the person that there is a risk of blindness with me injecting you in this area. And if they're okay with that, then you can do it. But most people are not okay with that, and they're okay maybe going with a different modality of treatment. And then the reactivation for HSV, always ask, and if they're not sure, prophylaxing, we have acyclovir in the office, and we routinely give it during the procedure, and if they are not going to be going to the pharmacy, we give them some for the next day. I will prophylax people for a couple days out. There is no standard for this. Ideally, you prophylax them a couple days before and days after, but there is no, this is the way that you do it type of thing. Bruising, redness, and swelling, they will swell, and as you gain more experience with it, you'll become more and more comfortable telling them, yes, you're going to swell, that's good, that means the nutrients are coming in and it's healing. Your body is accepting that the product's there, and it's going to just take some time for that swelling to go down, but that's a good thing. It's hard, and the first couple times you have it, you're going to be as nervous, if not more nervous, than the patient is. But for the most part, the swelling goes away. Make sure that they ice. Ice is key, 15 minutes on, 15 minutes off. Ice packs are really good if they're the ones that the company gives, usually a little disc. Frozen peas are phenomenal. You don't want them to leave it on for hours. Some people use the ice packs they get from the grocery. Those are too cold. So you don't want to use a grocery pack. You want to use something that will heat up. You can put pressure on these areas. You can roll fillers into the proper location. I'll never forget, I did a rotation with Bruce Katz when I was a dermatology resident. And he's in New York, and he's a great physician, and he had this woman who's one of the most beautiful women I've ever seen, and he injected her lips, and she looked like she came out of a magazine. They were so wonderful. And the next day she came in, and she was so upset. I look like a whore. These are terrible. And she asked me, what do you think? I said, actually, they look great. You know, they're very nice. And his recommendation was just roll it to where you want it to be, and over time it will flatten out. And it is true, it does flatten out. You can mold these products into place. Worst case, you could cut into it and drain it out, if that's what you want, or inject with the hyaluronidase. But telling people to ice these areas is really important. Some people believe in arnica. I go back and forth on this. We used to sell it. We don't sell it. There are a lot of people who do believe in arnica and bromelain. Bromelain's a pineapple extract. Arnica is a plant. And for people who are into homeopathy and into fillers and Botox, those are the people that you can use those products in. There's nothing wrong with it. It shouldn't hurt them in any way. And it may be okay. And so that's it for just the lecture portion that I had. Are there any questions that anyone has about what I spoke about? Go ahead.